Please welcome Director of the Office of Climate Change and Health Equity at the United States Department of Health and Human Services, Dr. John Balbus.
Good morning, everybody. I want to give a huge thank you to the organizers and colleagues here at the Bloomberg American Health Summit. I'm very grateful to have this opportunity to speak with you this morning. Let me just start by acknowledging, all of us acknowledging, that we are in hard times right now, and we are all in need of hope. And maybe I'm just going to take a big sigh standing up here. We can all take a sigh together and pull our hope and our compassion for what's going on in the world around us, the war, the strife, etc. And it's November, but the summer of 2023 was also a really hard time. As the Earth's temperature soared to record-breaking levels, we learned once again that climate change is harming our health, with the impacts disproportionately affecting those already experiencing the short end of health disparities. And sadly, after this summer, we can put new numbers on these disparities. We learned that out of 425 deaths that occurred because of heat in Maricopa County, that's where Phoenix is, in 2022, 425 people died. 2/3 of those deaths involved substance use. 90% of those, or over half of the total deaths, involved methamphetamine. Striking numbers. And the number of deaths in Maricopa County has soared well beyond 425 this year with the heat of 2023. Of the 13 people who died when the remnants of Hurricane Ida struck New York and New York City, 11 of them were recent immigrants in poorly maintained underground apartments. John Holdren, former director of the White House Office of Science and Technology Policy, famously said that when it comes to climate change, we basically have three choices: mitigation, adaptation, and suffering. And we're going to do some of each, and the question is what the mix is going to be. Those are his words. What we've lived, our experience this year, is that because we as a society have failed so far to mitigate or adapt, suffering is dominating the mix. But it doesn't have to be that way. And here's my bottom line. The health sector is essential to reducing the climate suffering of disadvantaged populations. But it's not going to happen magically. It will happen by the health sector showing extraordinary leadership, not just in providing care to those suffering, but through health system mitigation and resilience. Bear with me on this. The health sector represents over 20% of the nation's GDP. It's often communities' largest employer, and it also contributes about 8.5%. I'll say that again, 8.5% of the United States' total greenhouse gas emissions. In order for health to find its rightful place as part of the climate solution, seems like we have to stop being such a big part of the climate problem. Climate leadership throughout the health sector can set up a virtuous cycle that will accelerate progress, not just for our health systems, but for our communities. Okay, those are nice words. I can stand up here and say nice words. But what does that look like? Let me give you some examples from what the team in my Office of Climate Change and Health Equity is doing now. We made a commitment at COP26 in Glasgow to make the U.S. health system both more resilient and also less of a polluter causing climate change. How much less? In line with the Biden administration goals of 50% reductions by 2030, net zero by 2050. And in 4 weeks, we're going back to COP28, having made meaningful progress. We've initiated a health sector climate pledge with the White House that has engaged over 115 institutions so far, comprising 1 in 6 hospitals across the country and many Fortune 500 pharmaceutical group purchasing organizations, medical device manufacturers, etc. We've brought together the U.S. federal health systems, including the Defense Health Agency, the Veterans Health Administration, the Indian Health Services, the Bureau of Prisons, and we're developing clinical guidelines for all the clinicians in those systems to help reduce the greenhouse gas emissions associated with care in them. We're launching a catalytic campaign to collect rural and safety net hospitals and community health centers to financial resources that will give them renewable energy systems and health system microgrids, as well as other resilience measures through the Inflation Reduction Act and the funding available in their programs. And we're supporting community-led climate resilience centers that embed healthcare services in a suite of human and social services to provide year-round support for disadvantaged communities, as well as providing a critical refuge in times of crisis. The opportunities here, to me, are very exciting. For example, how many of you know that the wasteful use of anesthetic gases can contribute as much as 40% of a hospital's direct greenhouse gas emissions? That's the anesthesia that they use, 40%. That one type of anesthetic gas, desflurane, has over 2,500 times the global warming potential as CO2. And the rest of them are not good actors, much more than CO2 as well. In published studies, innovative use of electronic medical record data to give real-time feedback to anesthesiologists has resulted in a 50% or more reduction in the emissions of those anesthetic gases within just a matter of weeks. This not only helps save the planet, it saves the hospital money. Maybe even more exciting is work we're doing with partners like the Charge Partnership. Charge Partnership brings together the National Association of Community Health Centers, a community finance organization, and a designer and installer of solar energy and health system microgrids. The result? Low-income communities get direct investments, frequently not just for the health system or the health center, but also for residents. They get a climate-resilient health center that can serve as a refuge in a disaster, and they get a community health center that has more funds to put to patient care. This is just a taste of how our office is approaching its mission to protect health in the United States from climate change, especially for those most vulnerable. But would you agree this tastes like hope, like optimism, like activism, and like social equity? I hope so. So this is the message that we're bringing to the first ever Health Day at COP28. Climate action needs to be embedded throughout the practice of medicine, social services, and public health. The actions must include both resilience actions and greenhouse gas reduction actions. Once we've achieved that, we will not only be well on the way to bringing more equity to communities suffering from climate change impacts, but the health sector will have something more tangible and concrete to bring to the climate policy discussions. It's not enough for health to just demand a seat at the climate table. By taking the path of leadership and making climate actions routine throughout all of our institutions, we will have earned that seat.